Miami. Not a lot of resemblance here, but we try to switch here. I'm going to be a little bit of the devil's advocate today and talk about robots and why you shouldn't waste your money on it. I know we're looking at innovation, but I'm going to go the opposite way here. My disclosure is not really relevant here. So, currently the hot buzzwords, the sexy words here in spine surgery, artificial intelligence, robots, innovative technology, it's all great. And then certainly when you look from an economic standpoint, what's Wall Street doing? You see, particularly minimally invasive surgery, there's billions of dollars pouring into it, and under that umbrella, robotics is a big part of that. Again, billion-dollar industry. So what does that mean for us? Robots are coming. They're here. So we have to pay attention to this. So, as a young spine surgeon and you're talking to the different companies with the robot, what are they saying to us? What are they trying to sell it to you? All right, Mike, well, it makes you faster. I'm like, okay, I like that. I want to do more cases. I want to be more productive. Start cranking out those RVUs. That's all great things, right? Okay, I'm interested. What's next? Oh, your patients are going to love you. Your outcomes are going to be fantastic. Oh, awesome. I love that. This is great. Just tell me more. What's next? Cost effective. It's going to bring down costs. Your hospital administrators, they're going to love you. They're going to name a wing after the hospital after you. You get a parking spot. It's going to be great. All right, fantastic. Sign me up. Give me my robot. Actually, but we'll analyze these a little bit deeper. But what does the FDA classify the robot as? It's an orthopedic stereotaxic instrument. So my talk's over, right? The FDA classifies it as navigation. Okay, but I still have more time, so let's dive a little deeper here. So what are the operative challenges? Anytime you implement a new technology into your OR, there's an initial learning curve. There's the surgeon. You have to learn how your workflow is going to and how your OR is going to be set up and how you're going to use this effectively. You have to train your OR staff. There's limitations in that. And then heaven forbid that you get a new OR staff and have to train those people. And then you have to develop a functional ecosystem to be able to be effective and efficient. So they did this, and you look at the literature of this, say, all right, so is there a difference between timing of your surgery? Are you really faster with the robot? And this is a meta-analysis retrospective where they look back at a lot of retrospective reviews here, and they found that there was no difference in freehand pedicle screws versus robotic placement of screws. And in fact, there was increased operative time for that. Okay, so I'm getting a little less interested here in the robot. What about outcomes? Ultimately, when we're implementing a new technology into our OR, the number one thing that we need to think of is our outcomes. So here's a good review in the deformity realm of looking at robotics and navigation, and they compared also to freehand pedicle screw placement. And the conclusion here is that there's really no current clinical evidence that the use of navigation or robotic technique leads to any improvement in your patient outcomes or decreased overall complications, reoperation rates, and quite honestly, it says it may substantially increase your surgical costs. A little foreshadowing there. And then also, Dr. Qureshi's group here also compared minimally invasive lumbar fusion with navigation and robotics, and similar outcome. Robotics did not seem to lead to any significant better clinical outcomes. Okay, so maybe what they were telling me wasn't true, huh? All right, and then finally, cost effectiveness. What's the benefit here? Here's a good analysis where they did a propensity matched patients in robotic surgery, open surgery, and MIS, and they looked at the cost of robotic case was found to be significantly higher, $60K versus the open and MIS, and most importantly, look at the cost per quality significantly higher for the robotic case. And then the cost evaluation. You have to bring this up to your hospital administrators, and you're going to say, the robot's going to have a price tag of $1 million. So as you continue to talk, they're just going to keep looking at that price tag. And then there's also the thought of hidden costs, disposables, maintenance, repairs. So, even the literature has some, I'll concede that there is some literature that says that you get a theoretical cost advantage, and it's like cost effectiveness that you would save approximately about $500,000 with the use of a robot, but those theoretical cost savings aren't going to matter when they're looking at this price tag. So other challenges, we have to think about resident fellow education, reliance upon the robot. If the robot goes down, are you going to cancel your case? If that's the point that you go and talk to your patient, then they're going to say, just send me to the robot's clinic so he can schedule my surgery. That's not something you want. You want to take care of your patients. And then there's also the limited procedural abilities that we have at this time. At that point, it's really just a retractor or just placing pedicle screws. However, it is an exciting time. We know that there's a lot of advantages in robots. We are a little bit lagging when you compare us to the urologists, general surgeons, and certainly the OBGYNs and the use of robots within their ORs, and I think the future is interesting and how it's going to pan out, and I'm looking forward to see what's happening as the robots they're coming for us. So.